On the 20th of September 2013 in Milan, the second European Joslin-Sunstar Diabetes Education Initiative took place.
Vorrei esprimere i più sinceri ringraziamenti per la vostra partecipazione.
The significance of the Joslin-Sunstar partnership is to encourage interprofessional management of patients who suffer from these two chronic diseases, diabetes and periodontal disease.
This is really the first time a true and major collaboration between the medical and the dental field has occurred.
This innovative approach was first promoted in Japan, then in the US, and started in Europe with the Geneva JSDEI in 2012. Increasing the geographical scope of the initiative reflects the need to address a global public health issue.
Right now we're in the midst of a worldwide epidemic of diabetes and obesity, and what we are looking for together are ways to both improve the treatment of patients with diabetes and obesity, but also to find ways, hopefully, to prevent the occurrence of these diseases. An epidemic of obesity, which is also taking place worldwide, even in undeveloped countries.
Over the last 10, 20 years, there has been a huge amount of evidence which has been accumulating, showing that there is a link between all diseases and diabetes.
The topic today is one of the leading causes of periodontal disease.
The treatment studies of periodontitis, for example, shows that after periodontal treatment, the metabolic control in patients improve.
If the periodontal disease is resolved, the diabetes management is made easier because there's better control of blood sugar.
And it covers completely the alveolar process.
Scientific evidence is here, but a lot remains to be done to transfer this knowledge into everyday clinical practice.
There is a lot that should be done, both research-wise, so funding research project, pure research, but also, let's say, supporting clinical practice.
So far, I've been discussing parameters which are relevant for type 2 diabetes.
In my opinion, what is important is really to highlight what do we know about these diseases.
When I see a diabetic patient and I know he is uncontrolled, then I also have a contact with his physician to discuss if there are other treatment plans to improve his diabetes control, and then I know that my periodontal treatment is also more effective. And I think that makes the difference.
Bacteria are identifiable by the sequence of that gene.
High glucose will also deactivate protective factors.
It's become clear that the physician and patient are not enough, that there must be other people on the team, including nurses and educators, who can help transmit this knowledge. And of course, in the case of oral health, also people from the dental team, dentists and hygienists.
Che noi spesso, gli odontoiatri, come un po' tutte le categorie mediche, non parliamo tra di noi, invece è molto importante interagire.
If the physician and the dentist collaborate, the patient is treated more efficiently.
All new knowledge is actually helping me in my job teaching the students.
Sono studente, appunto, la mia tesi è sul diabete e quindi mi interessa molto questo argomento.
How simple could be the treatment? And this is the big question.
In the process, we are identifying other cut loci that are specific to diabetes.
Concerning type 2 diabetes, I show you some data showing that definitely metformin has a systemic action.
Really informative.
C'est un bon vivier, c'est un bon moment d'échange.
Persone molto competenti a livello mondiale.
Ça nous donne une approche plus médicale de notre profession de parodontiste. Spero poi di riuscire a lavorare ancora meglio sui pazienti.
Very good. Very good speakers.
Captivating.
I really hope to be invited the next year.
As a dentist, you can play a more active role in the early identification of patients with diabetes. As a general medical practitioner or diabetologist, you can help patients better control their diabetes by understanding the significance of periodontal disease relating to diabetic patients.
We hope that this partnership will lead us to increased interactions, not only in the US and Europe, but also worldwide.
Open up new frontiers by adopting a new approach in patient management through collaborative practice, and join this growing community to help your patients live a better life.
We can contribute to the dramatic change of the society, I'm sure.
Education, education, education.